Welcome back to my channel. If you're new here, my name is Neil Galve. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, please make sure to subscribe now, hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. Good morning, everyone. How are you guys doing? Good morning, Abba. Good morning, good afternoon, and good night, just in case I don't get to see you. Like you hear on the title, or like you see in the title, today we're going to discuss about Crizanlizumab. This is another entry natin sa ating nursing pharmacology. Another nursing drug study nga ang alay ko sa inyo for today. Ngayon, gusto ko lang batiin lahat na advance Merry Christmas 4 days ago and it's going to be Christmas. Kamusta ang paghahanda nyo ngayong Pasko? And ilang araw na nga lang at matatapos na rin ang bagong taon. Kaya matatapos na rin bagong taon. Matatapos na rin itong taong ito. At gusto ko lang kayo pasalamatan because this year, we reached 17,000 subscribers. Palakpakan nyo yung mga sarili nyo for showing up for today's video. Maraming salamat po sa patuloy na pagsuporta nyo sa akin, for keep on supporting my videos here on YouTube. And just so you know that I'm still gonna continue uploading nursing educational videos for all of you guys. Thank you so much for all the help. I hope by next year we'll be able to make it to 20k or 30k or 50k. And maraming salamat po. I'm just so grateful. Ngayon, kung hindi mo pa napapanood yung other nursing educational videos I created on my channel, I'll be putting the playlist link on the description box, or whenever the icon button pops out anytime in this video, click the one out because I'll be putting it there too. So, hindi ko na patatagalin pa kasi medyo mahaba itong discussion na to. Let me proceed to the formal discussion. Today is all about nursing pharmacology, nursing drug study of Crizanlizumab monoclonal antibodies. If you haven't heard about this medication, this is your chance and this is the day that you will be introduced to this medication. All right, let's proceed. All right, let me give you the objectives for today's discussion. Well, we're going to have classification, generic, and brand name, route, and dose of administration. We're going to discuss mechanism of action. I'm going to tell you indications, contraindications, side effects, and of course, this will not be called nursing drug study if we're not going to talk about nursing responsibilities. Handa ka na ba? Handa na. Mag-proceed na tayo. First up, classification, generic, and brand name, route, and dose of administration. Mabilis lang tong discussion na to. Very straightforward. So, class. This is a monoclonal antibodies. This medication is considered a monoclonal antibodies. It works by blocking certain blood cells from interacting. Protein-based therapy nga po. This medication is is what we call protein-based therapies. Now, Crizanlizumab is sold under the brand name Adakveo or Ryverna, both by the pharmaceutical company Novartis. Now, like I said, this is a monoclonal antibody medication that binds P-selectin. In terms of dosing and the route of administration, Adakveo, which is the brand name, is once monthly treatment to reduce the sequence of VOC and CSD. Ano yung VOC? Vaso-occlusive crisis in sickle cell disease. Sa mga pasyenteng diagnosed with sickle cell anemia, this is their medication. All right, so here's the dosing. 5 milligrams per kilogram is administered by IV infusion over a period of 30 minutes at weeks 0 and 2. Then every 4 weeks. Again, 5 milligrams per kg. Kg, yun yung weight ng pasyente mo. It is going to be administered by what route? IV infusion. Over how many minutes? 30 minutes at weeks 0 and 2. And then after 4 weeks. Each dose is the same, 5 milligrams per kilogram based on patient's actual body weight. Kaya importante yung kukuha tayo ng baseline data every admission ng pasyenteng for Crizanlizumab infusion. Now, Adakveo or Crizanlizumab may be given with or without hydroxyurea, which is another medication given for what? For sickle cell anemia patients. Do not mix or co-administer with other drugs through the same IV line. This is one of the high alert medication kasi nga ito ay antibody. So it should be, kung sa ospital nyo gumagamit kayo ng IV infusion, different line po. Different line meaning you're not gonna mix it with other medication like IV fluids or heparin infusion or potassium correction. It should be different and it should be labeled accordingly. Alright? Malinaw ba yon? Malinaw tayo sa classification, generic name, and route and dose of administration? Malinaw. Take the screenshot of this because it will be helpful for you to remember the route and the computation of your Crizanlizumab. Alright, mechanism of action. How does this drug works? Let me explain to you. Alright. Now, Crizanlizumab binds to a molecule called P-selectin on the surface of platelets and endothelium in the blood vessels and has been shown to inhibit interactions between endothelial cells, platelets, and red blood cells, sickle red blood cells and leukocytes, causing a blockage and therapy preventing these cells from being. So it binds to the cell called P-selectin on the surface of the platelets para maiwasan yung blockage. Di ba ganun ang nangyayari sa sickle cell? Due to the shape of their red blood cells, C shape, it causes the blockage on the blood vessels. Right? So what the Crizanlizumab does is that it inhibits the interaction between those endothelial cells for it to become or to prevent these cells from being, from blocking the the blood vessels. All right. So once again, that is the mechanism of action. Let's proceed. What are the indications? Kanino mo nga ba ibinibigay ito? Simple lang naman. Ito siya. This is indicated to reduce the frequency of what? Vaso-occlusive crisis. Ito yung sinasabi ko kaninang VOCs. Vaso-occlusive crisis in adults and pediatric patients aged 16 years and older with what? Diagnosed with sickle cell disease. All right? Okay. Next, contraindication. Kanino mo siya hindi ibibigay? To those patients who are what? Pregnant. Pregnancy, having a sickle cell disease during pregnancy may increase the risk of what? Premature birth or low birth weight. The benefit of treating sickle cell disease may outweigh any risks to the baby. Hence, the contraindication is pregnancy. Sa mga babaeng may sickle cell anemia, you might ask, when is the last LMP? Or they can run some pregnancy tests before administering the medication because this is contraindication to Crizanlizumab infusion. All right. Now, proceed na tayo. What are the side effects of administering Crizanlizumab? It's very important for us to understand and to differentiate what is the importance between side effects and adverse effects. Side effects is how do you define this? Sorry. I'm having allergic rhinitis again. Side effects are those expected effects upon giving or upon administering Crizanlizumab or a certain medication. Adverse effects are those unexpected and can certainly give you an idea that the patient is not interacting well or receiving the medication well, not responding well to the medication treatment. All right. So side effects, along who its needed effects, a medicine may cause some unwanted effects. Although not all these side effects may occur, if they do occur, they need medical attention. You have to consult and you have to immediately report them to the provider or to the doctor. All right. So let's proceed. I list down more common side effects and less common side effects para lang mas spot on mo siya once na nag-nursing assessment ka sa pasyente mong nag-undergo ng Crizanlizumab infusion therapy. Sa mga more common side effects, here it is. Back, joint, or body pain. That's very common. Chest pain or discomfort. diarrhea, difficulty with moving, fever, muscle pain or stiffness, nausea and vomiting, sore throat, stomach pain. Those are the common side effects. So, meaning if the patient is complaining of one of these symptoms, one of these symptoms, you can expect that that is a common side effect through the medication. There's nothing to be alarmed, and it's very important for you to also educate your patient about the more common side effects and the less common side effects. In that way, you will alleviate their anxiety. Now, in terms of the less common side effects, less common, hindi bibihirang mangyaring side effects. Here's the list: chest tightness, chills, dizziness, flushing, headache, itching skin or rash, sweating, trouble breathing, unusual tiredness, or weakness. Once again, these are the more common and less common side effects of Crizanlizumab therapy or medication. Eto na tayo sa last part. Mabilis na tayo matapos. Pero bago yan, gusto ko lang kayong ianyayahin kung hindi ka pa nagsasubscribe and you've reached this far of this video. I highly suggest for you to subscribe now. You hit that notification bell so that you will be updated every time I upload a video. Also, follow me on all my other social media accounts. I have all social media accounts, including a podcast channel. The link is going to be on the description box. Check the one out. Now, nursing responsibility na nga ba tayo? Handa ka na ba? Handa na, of course. So, I have here the list. Makinig. 1. Monitor frequency of vaso-occlusive crisis during therapy. This is more of like your nursing assessment. Monitor for signs and symptoms of infusion-related reactions such as severe pain, fever, chills, nausea, vomiting, fatigue, dizziness, pruritus or itchiness of the skin, urticaria, sweating, shortness of breath, wheezing during and within 24 hours of infusion. Why? Because this will tell you that the patient is developing adverse side effects. Malinaw ba yon? Malinaw. Now, for mild to moderate reactions in a rapid infusion or slow rate of infusion. Pag nakaka-receive ka kasi ng Crizanlizumab infusion, normally kinakalculate yan ng infusion rate for 30 minutes. Makikita mo dun sa medication. At least dito sa aming SOP dito sa aming hospital. Pero depende yan. So kapag nakakita ka ng mild to moderate reactions, you can lower the rate of the infusion. Kung ang order is 30 minutes lang, you can make it 1 hour. In that way, to consume for 1 hour. In that way, you will and try to observe and also observe for if the reactions of the patient persists. Because that's the time that you're going to stop the infusion and you inform the doctor. All right? Next, begin symptomatic therapy. Ano ba yung sinasabi kong symptomatic therapy? You can give, along with Crizanlizumab infusion, the doctor may also order some medications as a response to symptomatic therapy. Let's say may headache, o bibigyan ng acetaminophen, NSAIDs, opioids. Lalo sa mga sickle cell anemia, they normally have regular dose of morphine, antihistamines, intravenous fluids, and or oxygen therapy. Very important sa mga sickle cell anemia ang hydration. Alright. Consider pre-medication and or reduce infusion rate of subsequent infusions. Alright. Last one, discontinue therapy for severe reaction. Hence, you have to monitor the patient during and within 24 hours of infusion. And that was it. Thank you so much, you guys, for watching. Hope you liked this one. I hope you learned something today about Crizanlizumab medication. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Abangan nyo nga po yung next upload natin ngayong Friday because it's going to be amazing. Another nursing discussion nga. Tulungan nyo na nga po ako. Ipamalitan nyo na sa Radyong Sira ang pinakabago, pinaka-fresh at ang pinakalibreng nursing review center sa balat ng YouTube. Don't forget to follow me on all my other social media accounts. Everything is at Neil Galve except for my TikTok account, which is Neil Galve Official. Follow my podcast channel. It's 3 a.m. Conversation with Neil Galve. The links is on the description box. I'll see you again on Friday. You have a good one.